Hey everybody, it's Dr. Phillips here with Texas Chiro Health, bringing you your 12 minutes, Tuesday 12 minutes to health. I'd like to thank everybody for being with us and joining us each week that you guys get to. I really appreciate it. It's nice to see the response and those people just looking forward to learning how to eat better, move better, and think better as they work towards homeostasis and just being a healthy human being. So, that's our goal, is to help everybody that we can live a healthier, happier lifestyle. So we like to do that through the research and sticking to what the facts say. So each week, I've committed to bringing you guys the best research that I can find, the peer-reviewed randomized controlled trials that are they're the facts, on how to live a healthier lifestyle through eating well, moving well, and thinking well. That way you don't get just our opinions, but the actual research, the randomized controlled trials that are peer-reviewed to learn how to reach homeostasis and live a healthier lifestyle. So thank you guys. For those of you guys that are in the clinics tonight, thank you for being there. Enjoy the refreshments. Get yourself a green smoothie and just kind of sit back and listen to our studies tonight about vitamin D. And I think most importantly, when you're in there, make sure you ask questions. Don't leave tonight without having the questions answered and the answers that you want to living a healthier lifestyle and just being a better version of you. So make sure that you pick the doctor's brains while you're in there and then enjoy the research tonight. Tonight's research is on vitamin D. It was done by Martineau et al. It was called Vitamin D Supplementation to Prevent Acute Respiratory Tract Infections, a systematic review and meta-analysis for individual participant data. So essentially what that means is this group of people, they took all the research that they could find on vitamin D, and their stipulations on it were that it had to be a randomized controlled trial, a double-blinded study, where they were using, some people got vitamin D, some people got a placebo, and they were measuring the effects of that, right? So they wanted to see, how does vitamin D either boost our immune system or affect our immune system in a way that it's handling these acute respiratory tract infections. And what they found is that when taken correctly, the right supplements, in the right amounts, at the right times, that it's making a huge difference in people's health. And we're actually having great results fighting off respiratory tract infections. And you've seen it here lately with COVID. If you've watched any of my presentations here, there was just a randomized control trial, the first one done with vitamin D and COVID, and it was very successful. It dropped the rate of people entering the ICU. The people that died from it, the rate came down, and it was all dependent on their vitamin D levels. So vitamin D is hugely important, and there's a couple other things that can go along with it to make it even better for you. But what you really want to focus on is a good, high-quality organic vitamin D in a non-inflammatory medium. So the oil that it comes in or whatever it's coming in, it needs to be non-inflammatory, which we'll talk about a little bit more here in a minute. But first, let's talk about vitamin D. Typically, as humans, we get a lot of our vitamin D, our natural vitamin D, from the sun. So the sun hits our skin, which interacts with cholesterol in the skin and blood, and then that travels down into the liver, okay, where it goes through a couple more processes and different reactions to where it is then shipped out to the cell, and every single cell in the human body. So when it gets to the cell, there's one more reaction it goes through, and it becomes 25-hydroxy vitamin D. Okay, and that is the usable form for us. It takes up the cell receptors, and it starts to allow vitamin D to do what it does. And when you look at our immune system, at these acute respiratory infections, it modulates our immune system. So it goes in and says, okay, let's bring in some inflammatory cells, some cytokines. Let's start beating this thing, but not too much. Let's control this. We don't want this to get out of control with the inflammation and everything. And that's what they found in COVID that is so important about vitamin D, is its modulating effect, right? But it needs to be in the right levels as well to recognize these things and activate the immune system. So very, very important, really hormone more so than a vitamin, but very important to our bodies, to us reaching homeostasis, and to us just being healthy. So vitamin D is a big one, which we usually get from sun. The problem, we don't sit in the sun anymore, right? That's why I did this one outside today. So hopefully it's not blinding or anything, but I wanted to get some sunlight and just kind of stress the vitamin D point. But most of the time, if you look at it, we're stuck in an office. We're stuck inside. I mean, here in Texas, it's been 100 degrees for months now, right? So it's just nicer inside. If you're not in a pool, you got to be inside type thing. So now it's getting nice. Now we can get out and we can enjoy the end of the day sun time like this. It's not too hot and we can get some more. But whether we're getting the sun or not, we still need the vitamin D. It doesn't change how much vitamin D we need, and that's why we have to supplement it with a good quality supplement. And this study goes to show that if you use synthetic supplements, you don't get the results. You're not going to get the effects of vitamin D like you do with a natural organic supplement. And it also showed that if you overdo it, a lot of these studies did bolus dosages, which they call, right? So normally it's like 4,000 to 5,000 IUs a day of vitamin D that we need, and that allows our body to function, and we use it normally, and it keeps our blood levels up where they need to be for the benefit. But they wanted to see, like, well, is more better, right? The typical American attitude that more is better. So they gave like an 80,000 IU dosage. But what they found is we got rid of most of that. It didn't raise our blood levels. It didn't have the effects on the acute respiratory disease or infections like the daily doses or even the weekly doses. I mean, I don't suggest doing it weekly, but it is better than a big bolus dosage. But you're not going to beat daily when it comes to taking your vitamin D, and that's at 4,000 to 5,000 IUs a day. So make sure that you get your vitamin D in a good quality source, right? When we look at our blood level, in this study what they found was that when we got around 25 nanomoles per liter, and that's just how they measure it, but that's the number they were looking for, that's where we started to see an effect. Okay, and it became a significant effect kind of at that line. Less than that was not what we were looking for. More than that was better, but this is the number they kind of nailed down. I personally think it's more than this because of the other studies that I've read and the different things that are newer. The stuff they're doing with COVID is about twice this they want to see you get to, because that's what they're seeing the best results at there. So I think that the studies are always going to vary a little bit just on how they're performed, but I like to go with the most recent data, so that's a little bit more than this. But the biggest thing that they found is that vitamin D supplementation was safe. It protected against the acute respiratory tract infection overall. And patients who were very vitamin D deficient saw the biggest gains and the most success. And they noticed that bolus doses they don't work. It's too much, and there was no benefit there. So make sure that you're getting your vitamin D daily, right? And make sure that you're not overdoing it. There are times that I'll tell patients, because of the very first line, it's safe, right? For a long time, we thought you could overdose on vitamin D, and it's just not true. I mean, technically it's true, but it takes a lot to overdose on vitamin D. You have to have very high levels of it in your blood, and you need very high levels of intake daily to raise it. So it's very difficult to do. And so when I have patients, or even myself or my kids or anything like that, if I notice a scratchy throat, if I notice a little bit of a fever, anything, I always take some extra vitamin D. Just to make sure that I'm not missing it. And, I'll excrete what I don't use, but maybe that little bit does help. And newer research is agreeing with that. So I think that it's very important that you do that. One other thing that I always like to tell people about is including vitamin A with it. Okay, so in our clinics, we include our omega-3 fish oil and cod liver oil, both which are anti-inflammatory mediums. So vitamin A and D actually occur naturally in the cod liver oil in the correct amounts, in the right ratio as well, because these two work synergistically together, right? So basically they help each other out. And when vitamin A and vitamin D from cod liver oil is supplemented at the right amounts, that 4,000 to 5,000 IUs of D a day and the correlating vitamin A, then what you notice is about a 3-time higher absorption rate of the vitamin D. And you get better results when you're looking at acute respiratory infections or the flu every year or just the common cold, your coronaviruses, or even COVID right now. So very, very important that vitamin A and D are taken together if at all possible. But like I said, I have vitamin D by itself as well that I keep at the house that I encourage patients to have around, because you're going to need those little bumps of vitamin D here and there. And it's just easier to take the little dropper of vitamin D than it is to take more of my omega A and D. But all of it is very, very essential to us. And that's what it's all about. And this is why the daily thing works better than a bolus dosage, is because our body's constantly going. Our metabolism's constantly going. Physiology doesn't stop. We're using vitamin D at anywhere from 3 to 4,000 IUs a day. So to build it, we've got to be above that, right? We use the omega-3s in our cells, and we've got to have those included. And it's why we talk about having these essential nutrients every day. Eating well, moving well, and thinking well. Well, you got to go for a walk every day. You've got to de-stress every day. And I know we don't always get to it, right? I know I don't always get to it. I carry stress from time to time. I miss a walk or a workout here or there, or maybe I don't take my supplements. But it's something that I am very conscious of, and I very much try to get all of it in every day. Because for the same reason that I do all this research, I want to know what it takes to get to homeostasis. And now that I know, I can't just ignore that. I've got to do what it takes to get myself to homeostasis. And that's what I encourage all of our patients to do as well. But I know that's not always easy, right? This here is actually another one of the COVID-19 articles. If you guys are in the clinic tonight, ask the doctor for this little write-up. It was done in August. This is an observational study, but they showed that people with higher levels of vitamin D were less likely to suffer the consequences of COVID that people that didn't have those high levels had, right? So get this from the doc tonight, or swing by the clinic whenever you want. Like I said, they did do a randomized controlled trial in September, so right after this one as well. So, and there's going to be more of them that come out, and I expect the same results, honestly, because it's just human physiology. It doesn't really change that much as long as the studies are done correctly and they're using it the right way. Now, if they go with a big bolus dosage of vitamin D, I won't expect it to be the same, and that's just how physiology works. So, but like I was saying, I know it's not always easy. These talks are designed to help you understand and know everything, but at the end of that, you're still going to have questions, and that's why I tell you guys about our special offer every week. We are still working with Wounded Warriors right now through the end of this week, or the end of October. I guess that's tomorrow. Yeah, September. And then we'll start working with the local food pantry where each clinic is located to help get food together for Thanksgiving for families that need it and things like that. But what this is really about, guys, is you coming into the clinic and starting to work towards homeostasis, become healthy, get out of pain, get rid of your headaches, get rid of your joint pain, back pain, sciatica. I mean, you guys have watched my research. You know what it says about chiropractic care and getting rid of pain, and what we do with the lifestyle stuff, the eat well, move well, think well. I mean, there's no other intervention on the planet that has this many benefits to it and so few, if any, side effects, right? I mean, it's really a big thing. So get into the clinic. Let's do the spinal health assessments, the exam, the consultation, even if it's just a consultation. I mean, I consult with people all the time. It's just part of being a chiropractor. I talk to people about health all the time. And there's frustration. I can't get my vitamin D up on my blood work. I can't, my cholesterol's high. I have constant pain. And we dig into it and we look at it. Well, what are we doing? The vitamin D one, since that's tonight's topic, the number one thing I see is it's a synthetic supplement that people are taking. So they're not going to absorb it. And once they understand that, they make the change and they're good to go. Their vitamin D levels come up and they feel a lot better. So get into the clinics. Let's start to take care of yourselves. Let's get rid of those aches and pains. Let's live a happy, healthy lifestyle. It's homeostasis is, it's not always achievable every day, right? I get stressed out. I eat a bad meal. I don't go for my walk, whatever it is. But every step I take towards that, where I do the right thing, is a huge benefit to me. It'll be a huge benefit to you as well. So come see us either in McKinney or Lakewood, and we look forward to it. And then next week, guys, I'll see you back here on Tuesday night. Thanks for joining me. Bye.